Welcome to Planetary Health First, Mars Next. This is awesome. We are live at VIVE, and we have Bevey Miner, and she is leading the charge, EVP Healthcare Strategy and Policy at Consensus Cloud Solutions, and they're just some wicked, difficult problems. Imagine the Matrix. I think it was the red and the blue pill, but they're like taking across all these data and putting it back to receive it right. Tell me what you're doing. I mean, we have this interoperability problem. It's a huge challenge, and you're driving it home to make it work right.
Yeah, I mean, Michael, it's a great question. And look, I've been in the business about 20 years, and interoperability has been a challenge for 20 years in healthcare. We're not where the airline industry is, where we got rid of paper, plane tickets, because it's complicated. And what we're trying to solve is so much unstructured data in healthcare today, unstructured, lockdown, not consumable without somebody doing a lot of data entry. 80% of all healthcare data is unstructured data. And admittedly, there's a lot of images in there. But when you look at a statistic that says that healthcare is going to grow so big in the amount of data in the next 7 years, it will surpass any other industry. What do we do with all that data? How does that data become actionable and meaningful? Locked into that data are critical pieces of information for patient treatment. So our flagship product and what we lead the market in is digital cloud faxing. eFax is our product. We're a publicly traded company, CCSI on the NASDAQ, and we do 4 billion pages in healthcare faxes every year. This is a picture. It's a PDF when it's a fax. So somebody gets it, it's a sending and a receiving. On the receiving side, somebody gets it, it has to be data entered. So no matter how you send out information, we have to make sure that the receiving end, you go from a hospital to a skilled nursing facility, from a skilled nursing facility to home health, it's that receiving end that has to get the right kind of information for continuity of care. Otherwise, that's where we have the biggest errors of treatment for our patient population.
We're talking like medication reconciliation. Does patient X have the right medication for their blood pressure? It's critical.
Right. And that medication follows them to the next treatment. Mm-hmm. So we have stories of patients discharged from the hospital. They end up in a skilled nursing facility, and their records are not following them. So how do we make that very simple? The industry is pushing towards a standard of structured data. That standard is called FHIR, and it makes total sense. But we cannot demand it. It requires that you have sophisticated digestion and types of technology that can consume structured data. And that's great for an academic medical center, a big, large IDN, huge, big community centers. Now let's start to go to the outer rings and go to home health and go to a skilled nursing facility, go to assisted living, then go even more further to the outer rings. And you've got the substance abuse clinic, and you have the birthing center or the rehab center. Those centers, those care centers, were not given funding to get an EHR. They weren't given federal money to do it. They are barely off of a dial-up fax machine. And they need to have that continuity. You go from a hospital setting, and a patient may need to get substance abuse treatment. But you can't all of a sudden send them all this structured data in the cosmos, to use your analogy, and expect it to land on a planet anywhere and have anybody make sense out of it.
I think she's making a reference to Planetary Health
there
First.
You go. Yeah.
I love it.
But if you think about it, it's as big as a universe in trying to just even kind of communicate. Companies like Consensus can take that unstructured data, and we're a translator in the middle. So we take it from its very raw form, from its unstructured, we put it through our translation, which is called Conductor. We add our NLP, which is and our AI, intelligent document extraction. So now you have all this data, and it's in flight. It's out there in the cosmos. Yeah. It has to get on a translation highway to be sent. And that's what we are. And when I've talked to a lot of policy people about how we can really move interoperability forward, but not do it through a bunch of rulemaking. Rulemaking's great, incentivize the industry to move to this, But you have to remember, this is a health equity issue.
Yeah.
And when you say that's a health equity issue,
Yeah.
at both sides of the aisle are like, oh, yeah, we can't mess with that. So
Yeah.
what do? You let translation companies like ours sit in the middle and do that. Look, everybody at the UN doesn't speak English. You have translators that communicate.
I love how you translated to me, who's not the quickest. I get it.
Yeah.
It's so needed. And the problem is that we can't wait for the federal, for all these, and you can tell me all about the alphabet soups of all
Yeah.
those different things, but really when a clinic or a federally qualified health community or SNF needs it, or a hospice or home care, you guys are making it a cost point that works right. However you do it, I don't know what that is, but that's what needs to happen. And that's what you guys are doing.
Right. And we're really impacting patient care.
Yeah.
And the way we impact patient care is that if you have a bunch of people sitting around having to look a lot of, non-structured data, and your data entering, you're slowing care
Yeah.
delivery down.
Yeah.
And, we're all patients.
Yeah.
How many times have you shown up somewhere and they go, oh, we didn't get your record? Or you have a loved one that went from a hospital to a skilled nursing facility, and you're appalled that the information isn't where it needs to be. And I hear stories like this all the time. It's
Yeah.
happened to me. I needed an MRI, and somehow the paperwork sat with the, prior authorization process. So,
Yeah, or just going every time you have an encounter. They need us to fill out the
Forms.
clipboard. Yeah.
the forms, and
Yeah.
we recognize handwriting. So our artificial
Oh.
intelligence will take that form,
Mm-hmm.
and if you wrote something on it, if a physician writes urgent to try and get a prior authorization done, our machine learning has recognized handwriting.
Yeah.
too.
So, Bevey, while we're here, is there anything else that you would like so we can get anything else you would like to share today?
Yeah, I think there's a sense in this industry that we need to be so sophisticated in the way that we share information. And there's a lack of recognition that there's still a ton of paper fax machines that are being used. Why? It's simple. It's easy. It goes from one point to the next point. So when you start to recognize where people are in their digital maturity, these care settings, then we can take them to the next level, and we can move the industry along as we need to. And the technology does not have to be frightening, scary, or expensive to implement.
Yeah. Bevey, tell me, what sort of initiatives, 2024 is still we still got a lot. What's going right now on your radar, what you're doing, your organization this year?
Well, let's just take what happened last week as an example. Okay, our entire electronic prescribing backbone shut down. Now, that is probably one of the biggest examples of interoperability working. It's been working since I was pushing for electronic prescribing 2 decades ago.
Okay.
It works flawlessly until it doesn't. So what was happening is that physicians were now having to fax in a prescription or make a phone call. So the simplest technology is still got to stay around. And what 2024 is looking like is a real strong movement to more advanced types of data sharing. And we'll keep an eye on it. But at the same time, we want our kind of technologies and others like us to be able to come to the forefront of saying, oh, wow, I don't have to invest in all this new technology or new money. And I serve some of our most vulnerable patient populations, and that we can keep that continuity moving from patients that go from one care setting to the next care setting. I've been in this business a long time, and I remember my son is a healthcare attorney, and he keeps saying to me, Mom, you got to solve this problem before you're really old and sick, and I have to take care of you like you took care of Grandpa. And I'm that's a charter. We have to fix this. And it is an American healthcare system problem because it's not the same when you have socialized medicine.
Well, this is awesome. It's been so great to have you on and share
thank you.
what you're doing and really clearly articulating, something that's complex, but you're doing it how you're doing it. Yeah.
Yeah,
awesome.
Appreciate it. Thanks for having me, Mike.
Yeah, it's been great. Thank you so much.